Welcome to Wellness Rebranded, the podcast for women ready to redesign their relationship with food, fitness, and feelings.
We are a registered dietitian, a personal trainer, and a mental health therapist. 3 experts, 1 mission.
To help you break free from diet culture, hustle culture, and emotional burnout, let's redefine what wellness really means on your terms.
Today, we're diving into something you might not have heard much about, but it's changing the way people get support for their health and their emotional well-being. The concept we're going to discuss today is based on an important truth, people, that health is shaped by more than just medicine. It's also about relationships, purpose, activity, and support systems. So today, we're going to talk about social prescribing. And to help us understand it better, we're joined by Rebecca Haas, a certified life coach who works closely with this approach. Rebecca is also the programming and outreach manager for Anne Arundel County Public Library, those of us who are in Anne Arundel County, like us. And she's the author of 101 Seeds for Library Joy. She integrates positive psychology practices in her approaches in libraries, community engagement, coaching, and so on. And she owns her own consulting business called Joy Work LLC. She's going to break down social prescribing for us and how it's making a difference in people's lives. So, Becky, welcome. Thank you so much for joining us.
It's a pleasure. Thank you so much for having me.
Here's a quick story. Becky and I met because she completed the certification program to become a life coach, as I did as well. So we connected in an event recently, and then we're like, we should go out for coffee. We've never been to coffee before. So I put in my calendar, maybe an hour coffee with Becky. We went for coffee. We started talking and talking and talking. 3 hours later, we're both like, oopsie, maybe we should go back to, to whatever it is we had on our schedule. So a 1 hour, maybe 45-minute planned coffee turned into 3 hours because Becky is filled with knowledge. And that's why I wanted her to share with all of us today. So thank you again. So Becky, let's jump right on it. What is social prescribing?
Oh, thank you for asking. So this is a global movement. It really started in England, and it's about connecting non-clinical activities with our medical world. So thinking about things like our mental health, our physical health, but there's also our social health. And many of us are familiar with this concept of an epidemic of loneliness and isolation. And so this is one approach to really connect some of our formal healthcare system with less formal services, supports. It's really a wraparound approach. So things like art, music, movement, nature, volunteering, all of these things we know have positive connections and support for not just individuals, but also families, our communities. I think many of us can understand why those activities have a health value. So it's always easy to talk about this with Maria because she represents about half of them, right? So it's how we can connect some of those services. And some of this we can do today. We can do ourselves. We don't have to wait for someone to prescribe. You can feel the air quotes, right? But it's something that we can design into our own everyday and give ourselves that additional perspective, thinking about how we're helping our social health.
Mm-hmm.
So I've not heard that term before, although I love it and love everything that you're saying. And I'm curious, like, how is that connection happening between the medical system and the idea of the social prescribing?
So very beautiful question because it's so diverse, because it's a global model. So it's really allowed to take different iterations depending on a health system or a community system. So in some cases there are, like in England, they call it a link worker, and they're in connection with the patient or the customer to then give them a different options that will support their social health. right? So maybe it's helping to pay for transportation so that they can get to an art class. And then maybe they're helping to pay for that ticket to the art class, right? And maybe that's coming through a healthcare system. That's what's happening in England. Pretty awesome. Some others are using community navigators. So like in Anne Arundel County, we have a lot of system navigators. The Partnership for Children, Youth, and Families has navigators that you can call: English, Spanish, different resources. Sometimes it's family navigation. Sometimes it's an individual, right? So then they're helping to connect different resources and reduce barriers so that people have access to some of these different resources, whether it's food, healthcare, whatever that need might be. And with the library, it might also include something like a museum pass. So it's out of the box kind of modeling, thinking about things like forest therapy, right? So all of that is allowed to kind of count. But it's a little bit different model than maybe what we've had so far.
That's really interesting idea to me.
Well, interesting is that it took so long for us to start
Yeah.
talking about this, because think about it really. I would love to go to my doctor and then say that I have, I don't know, constant headaches, and then we can't find a reason. And then the doctor says, I'm going to prescribe, just write it down here in my piece of paper. Go out more with your friends, those friends that make you feel really good. Do it more, rather than, because, we all know headaches can be associated with stress
It's
and
so
all that.
true, actually. It's like such a no-brainer thing. Like, why did it take us until now to get it? That's an excellent point, Maria.
Or go get
You're
a
so
massage.
wise.
I don't know. I know.
But
I
there are
know.
No.
doctors who've actually done exactly that and have a little
Yeah.
notepad where they check off things like get outside once a day, right? Again, you're totally right. None of this is rocket science, but sometimes we need that permission slip, right? And so this is one more tool to do just that.
It's not rocket science, but the science behind it is really powerful. I'm sure I've told you guys before. I took a class, the mind body connection, through the lifespan in my master's program. And it's honestly, out of every class I took, it's the one that sticks in my head the most. The entire thing was about basically stress and loneliness and its impact in your body and on your health. And both of them, kind of the effects and the research around it, is jaw dropping in how it impacts your health, especially loneliness and isolation.
So when I first started working at the gym, this was about 7 years ago, there was this old man who was working out there, and he came every day, and he didn't do any exercise. He just like walked around the gym and like chatted with all the people. And even during the pandemic, when we were shut down, I would go to the gym and get dumbbells and stuff and take it out into the parking lot. And every day I would train my clients out there, using like 20 feet of social distancing. And he would drive by in his truck and sit in the truck and be like, "Good morning, young lady," and I once asked him, like, "Hey man, like, you gonna do some exercise today?" And he was like, "No, no, I'm not doing that." And I kind of laughed because, like, hello, it's a gym. And he was like, "I am here because my doctor was concerned I was like losing weight, I was having depression, I was dealing with a lot of heavy stuff, and he wanted me to go to therapy, and I just couldn't afford it. And he said, dude, you just need community. Go to a gym and just talk to people." And so that is what he did, and he was thriving. Of course, after the pandemic, I haven't seen this guy, so I don't know how that story ends. But like for years, he was thriving just by like creating his own social circle at the gym.
Tara,
Yeah.
I feel like so many of your stories include a person who's at the gym who never intends to exercise.
What's that
Did
message, Tara? That's a message there.
Yeah, I don't know. Like the majority of people are there for exercise, but I think the ones that stick out in my mind are like the weird ones, right? Like who comes to a gym to not exercise? But
Well,
he had
totally.
his
If he was
reason and
walking
it
around
totally
talking to
worked.
everybody, he
No,
was
we
getting
all
some
need
steps in.
We
We
all
know
need
now.
spaces, right? And that
Mm-hmm.
happens at libraries too. We
Mm-hmm.
had curbside service, but how many times people come to the library because they just need to be around someone? We're social creatures. I mean,
Mm-hmm.
Yeah.
that's how we're designed. So yeah, the community care and how that fits into some of this model, I think is really key. You know, the things that Maria's doing with the emotional fitness studio, those spaces where we can connect. I lovingly sometimes would say that I was a bartender fronting as a librarian because people would just saddle up, right? And then once they're at the desk, well, or calling us, we would get all sorts of different phone calls of people that were lonely, right? People that
Yeah.
were homebound. We have library by mail. It's a beautiful homebound service because it's short term and long term, right? People need access to not just resources, but also each other. So I love that story.
Do you ever feel stuck in the same exhausting cycle with food? Second guessing every bite, starting over each Monday, or wondering why willpower never seems to work? This is Elizabeth, and I created my intuitive eating starter kit to help you break free from that cycle. Inside, you'll get all sorts of tools to help you learn how to quiet food guilt, understand your hunger and fullness cues, and finally start building a peaceful, sustainable relationship with food. It's normally $29, but because you're a loyal Wellness Rebranded listener, you can grab it today for just $14. Head to elizabethharrisnutrition.com/starter kit and use code PODCAST, all in caps, at checkout. That's elizabethharrisnutrition.com/starter kit, code PODCAST in all caps.
So, Becky, actually, let's go back for a minute because I think this is important. You mentioned at the beginning the epidemic of loneliness. Tell me more about that because and then I'll share how I've seen it as well. And why is it so important to address it? So, what do you mean about the epidemic of loneliness?
So this is a concept that is recognized as a global epidemic. The World Health Organization just had a report that came out about social connection, and it's all related, it's all connected. It's recognizing that we have trends right now where people are lonely. And we don't really have a great scale, a metric to measure that. There's a bunch of different ideas of how we measure, but I think any of us that have worked with people we know what loneliness looks like. We know what it feels like. We know how it shows up in our own bodies, right? So it's not new. And I think this is the key is that it's increasing, right? And there's so many different factors that have contributed. And again, this is global. It's not just one part, it's all of us.
Mm,
So it absolutely impacts our health.
mhm,
With the United Kingdom, after they started social prescribing, they've seen a 25% decrease of ER visits.
mhm.
That's a
Wow.
huge number,
Mhm.
right?
Yeah.
It
So
makes
think,
sense though, right? Because loneliness is linked with like heart disease, stroke, dementia, all those like chronic health diseases. So prescribing more like social interaction, I get it.
Mhm.
it's a game changer. Yeah.
Mhm. And loneliness, I'm hearing you talk, Becky, and it makes me think that loneliness, just to clarify, does not necessarily mean physical. You mean physically lonely. You can be surrounded by people and still feel emotionally lonely, which is what I saw at the ER for 12 years, is the loneliness that comes even if you're surrounded by people, but still not feel seen or heard or valued or acknowledged, any of that. So that's what I talk so much about, that emotional connection we can have with each other and how it can be life saving, literally.
Yeah.
Do you think this is because the social media gives the illusion of being connected, but really it just replaces our better, deeper relationships?
I think that absolutely there's research to show that social media has impacts on our world, right? So, two words that often come to mind for me in this journey is thinking about belonging, right? That feeling of belonging and what it really feels like in practice. And then the other is dignity, because I think that's another key factor, right? When I think about the people that are coming into the library that are truly lonely, that I would love someone to have a scale to measure that with us. Very often it's because there's a lack of feeling valued. And so, how do we address that?
Yeah.
Becky, I'm curious how this came to be uh, a, I don't know if it's accurate to say it's a passion of yours, but you sound passionate about it, and I'm sure it is related to your library work. But I'm just curious, your personal story around this and how it came to be that this is something you love talking about.
Well, it's a COVID baby, like many, many
Mhm.
things. And I recognized what was working for me, for my team, for my family, for my community. And so much of it came back to community and connection. Connection is one of my core values. Joy is
Mm.
another. So, yeah, any chance to really amplify and support people's joy. And I think that's what libraries do every day. I've been really fortunate to get to work in so many different kinds of libraries. I was in Minnesota for a while. Talk about some connection. We had a knitting book club. It's still going. They've taken each other on a tour of yarn crawl in Ireland. I can't make this stuff up, right? Because they
A
became
yarn
family.
crawl.
Yes, it was
That's
a knitting
amazing.
book club that
That is
went
amazing.
international. So cute. They're amazing, right? Because those are the kind of magical things that can happen at a library. Because I've been part of it. I've seen it. I've gotten to help
So I
build it.
actually love that you're bringing this up because our library in Annapolis was recently renovated, right? It's amazing and beautiful. And when we drive by, every now and then my husband has said, I don't really see the point of that. Like, what's the point of a library in today's world? And I'm like super passionate about books and libraries, and it doesn't even matter. I maybe haven't stepped foot in the library in, 9 months or a year, but I don't care. But I would love for you to address that and how this conversation fits into it, because they're clearly so connected, which is kind of what I always say, but you actually know what you're talking about related to the library.
Libraries are fierce, fabulous ambassadors for our community goals. It's everything from your passions, your interests, your creative questions, your curious questions, and it's the whole life. It's lifelong learning. So it's helping families that have littles, but it's also helping support people in transitions. People come in for literally everything. You give me a noun, I will tell you a program that we've tried. I mean, seriously. We average 2,500 programs a quarter. That's not including all of our
Wow.
outreach. Yeah,
That's
That is
amazing.
amazing.
exactly. None of us are bored. I mean, really, it's,
2,500 a quarter.
yes, hon, it's busy at the library. So come over, get involved, get curious. I'm telling you, if you give me any of those art, nature things that you're interested in, chances are pretty high the library is here and doing something, and you can come and try and just sample, right? It's almost like a little charcuterie platter of activities. Hmm.
So, well,
Social prescribing snacks.
as an example, on this event that I met with Becky, the last one I was with my husband, and I'm saying hi to somebody. So Becky starts talking to my husband. They haven't met before. And after the conversation, my husband comes, did you know that the library has Duolingo? Like I could keep learning Spanish through programs through the library at no cost. And I'm like, well, yeah, I guess I didn't know. He's like, and they have all these programs too. So Becky took those 5 minutes to, they have way more resources that probably we are aware because we haven't
Yeah.
looked into their website or stop in and say, how can you help this project of mine? Most likely they will have a resource for you on whatever it is you're doing.
I actually take my son to the little playground at the mall fairly regularly. And where you're sitting on the benches, like watching your kids, there is like a glass advertisement, like on somebody's window behind the playground, which is like key placement. That's like, oh, did you know the library can save you like $5,000 a year? All these memberships to all these different places are included. I'm like, what? The
It's true.
library is a good kept secret.
Please, please,
A
you
good
all
kept
are now
secret.
library ambassadors. You have absolutely every permission to take this and tell everyone, tell all your clients. We can support you as entrepreneurs. We can support nonprofits. We can support you as an individual. We can support families. We're allowed to support whatever that looks like for you. And yes, free, free, free.
Now, I want to go back for a minute to what that connection and the trends of loneliness and how it's increasing and how what we can do. And you made me think, Becky, that that feeling of belonging and that dignity can be in our day-to-day interaction with each other. Like how many times, if there are two stores that sell exactly the same, I don't know, bottle juice that you like, whatever that is, and you go to one that you are greeted with happiness and you feel like they're happy to see you, to do business with you, but that one costs $10 the bottle, and you go to the other one that has the exact same juice and it costs $5 instead, but you come in and nobody makes eye contact and they're like, oh yeah, go to the shelf, yeah, next. You probably most likely would rather pay, the extra money for having that little interaction that makes you feel like a human in a world where we can see each other. Maybe $5 difference is a stretch, but my point is we can build this in our day to day. It's not only beneficial for other people, it's beneficial for you as well. What do you
And
think?
the research backs that up. I mean, the impact on our neuroscience when we feel seen, right? As simple as a smile
Mm-hmm.
or, right? I mean, look at Tara's smile. How can you not feel seen when you see this, right? It's so powerful, right? But you know that when you have those moments of connection, it's going to make you a better sale. And it's probably a sale that's going to last longer if you have that moment of feeling valued, right?
Mm-hmm.
Not just the customer, but also for you as the business person. I
Mm-hmm.
can tell you when I'm picking clients to work with my joy practice, I pick the ones that bring me joy. And that's
Mm-hmm.
by design because there's a cost to doing work, to doing business. So
Yes.
sometimes I will be selective about my clients because I'm going to pick the ones in the same kind of way, right? That maybe I'm not getting as much of a paycheck, but I'm going to have a more connection and it will feel more in alignment with some of my joy as a core value for myself as an entrepreneur. So that then I also have more sustainability toward my business.
I love that. Not only with clients, that should come with friendships, podcast hosts, you name it. Choose your people that are good for you.
Actually had a guy at the gym the other day who has never trained with me, like just knows me from the gym, like good morning, like that's the extent of our interaction, right? And he pulled me aside the other day. He's like, Tara, I think you're the best trainer here. And I kind of laughed internally, like, yes, yes, research would support that, but
You should be like, I
I'm
know.
interested. And he was like, you're the only one that ever smiles at people. And I was
Ah,
like, yeah, I mean, yeah, like to me that's being a good human being, right? But I do think it's my job to help the people that come to my business feel like this is the best part of their day. I want it to feel like a community where everybody is welcome, everybody is celebrated, and people feel that sense of belonging, you
Mhm.
know?
So
And I feel
important.
like other coworkers of mine haven't quite like wrapped their brain around that yet.
Mm-hmm.
Are you familiar with Priya Parker and the Art of Gathering?
I'm not.
Her book is amazing, and there's podcasts and all
Oh.
sorts of beautiful things. And for me, it's also about hospitality, right?
Mm-hmm.
Yeah.
It's how we make space together. Sometimes I
Mm-hmm.
call it the joy space, right? That permission for joy to be part of our lives and our design. So what does that look like? How does it sound? What does it look like in our physical space, but also in our virtual space? Even something like having guidelines. So when I'm doing sessions, the first thing I do is all in with grace. My spaces have to have grace in them, or I don't want to be in them. Nobody needs me in that space without grace. So, whatever that looks like, drinking water. This is one of my joy practices. So I'm going to tell you, sometimes I'm going to drink water. Cheers. Cheers. There you go.
I have a question for you. It obviously sounds so amazing and like we said in the beginning, and kind of a no-brainer, but what do you think are the challenges still involved with kind of fully embracing and adopting this, both as communities, but even more so a healthcare system? Because I think we all know that a lot of our healthcare system is more really accurately described as sick care.
Yeah.
And we don't do a great job in the promotion space, health promotion. But yeah, I just would love to hear from your perspective what challenges you see.
I think a lot of it is we have a very monetized health system. And so when we recognize that and help to really start naming the public-private partnerships that could exist, right? And if we can frame it from that space, then that means that we can also design some of our proposals in that space. So we can talk about things like data and results-based accountability and things like the rate on investment. So this information coming from all these different global countries about how this work positively impacts the bottom line for these big healthcare systems, it's too powerful not to get curious. So there already is research happening, NIH, Kaiser Permanente, pilots all over the country, businesses that are hopping up, art pharmacy. This is not only a viable model financially, but it's also the impact and the way this is now impacting communities, and you can't deny it. New York City, they have a whole movement called Vital NYC. It is an absolute transformative collaboration happening with art pharmacy, rec and park, healthcare systems, academic. There's research happening galore. So how do we get to be part of it? How do we really get strategic about asset mapping? Because I think that's what this comes down to. Many, many of us are doing this work. It's alignment. How are we aligning? How are we promoting? How are we getting access to people? Right? Because we know our transportation systems need some love and support. There are growing edges with transportation, at least in Anne Arundel County, right? So how do we get people, maybe they're going to get a voucher for Lyft, right? Maybe the prescribers help with that. That's some of the different design models that are happening all around the nation, and it's only going to keep spreading. So how can we support and strategize some of the different networks, the resources, so that we're in alignment? Because I think that's really where the strength of this comes in, is that it's really about connecting dots and networks that already exist, but they've been siloed.
Yes, yes, and yes, and yes. So we've talked about how our social connection matters. We've talked about how your public library can be here to help support your social health goals. What would be your message, Becky, on how our listeners could start self-prescribing? If this is not coming from their health providers, how can we self-prescribe, those steps towards a more social health? How can we do that?
Of it. So one of the things that often gets said about social prescribing is that our healthcare system says, what's the matter with you? And social prescribing says, what matters to you? So I love that question. It's so powerful.
Love it.
So even just
Me
grab a
too.
post-it or a journal or your phone and just give yourself a few moments, a few minutes, set a timer if you have to jot it down, especially thinking about social, right? What matters to your social health, wellness, connection? What does it look like right now? And then my favorite coach-like question, how might you dial that up, right? Even 2% counts. We often say this, right? So maybe for me, it's nature. I have to be out in nature at least once a day or I am grumpy and nobody needs to be around me. Yeah. So sometimes it just means going and taking a little lap in the parking lot. I have a tree that I like to talk to. I'm not going to deny this, right? My team all know. Have you been outside today, Becky? You're starting to look a little grumpy. Can we take you outside? Maybe we need a walking meeting, right? Isn't
I
that a good
love
one?
it. Love it.
It doesn't have to be a heavy lift to be impactful.
I absolutely love that reframe of like what's the matter with you to what matters to you. I think that was kind of a mic drop moment in the whole conversation. But I also think just framing it as social health, it gives it the importance and the weight that it actually deserves, right? And I don't think we talk about it enough in those terms. But of course, our social health and our relationships matter. And I just love the way you frame that.
And get it on the calendar. Really. In the same way that you would prioritize going to the dentist or whatever it is that matters to your health otherwise, put social activity, whatever that looks like for you, on the calendar. The day to day, 5 minutes outside, right? But it's also, okay, I've really got to schedule some time with one of my, I call it a joy buddy, right? I'm like, hey, Maria, we got to go out for coffee again, right? I need that joy buddy time. And I recognize that in myself. And then I prioritize it and put it on the calendar.
I think so often women in midlife, or really just women in general, think, oh, I don't have time for that, or, I'm too busy, or that seems like a waste of time going outside for 5 minutes. What's the point when I have 17 things on my to-do list that all need to get done before, whatever time of day? And you're right. I mean, I think every one of us here is sort of beating this drum all the time, but it does matter and we need to schedule it. And that's like another good reminder.
And there's a cost if we don't.
Mm-hmm.
And I think we all know that at
Yeah.
some level. And we see it. We see it in our loved ones that maybe are isolated right now, right? I'm certainly going to go up and visit my mom and I'm scooping her up and we're taking her out for lunch, right? Because she needs to get out. And I know that she'll let me take her because I bring my son and he is like my secret weapon, right? Won't say no to grandma. So what does that look like? And how do we make that space? Because you're right. If we are prioritizing the 17,000 things on our to-do list, but our social health is never one of them, guess what's going to happen? You're going to pay for it somewhere. We all know the impact of the body, right? The Body Keeps the Score. It's a great book. And it's true.
Yeah, it is
And
true.
our health matters. Our joy matters. We matter. Each of you matter. So how do we do this better? How do we do this together? And how do we keep doing this? Because it's fun. It's fun. We're allowed to have fun. It doesn't have to be just because it's good for us. It might be because it's good.
Yeah.
I feel like the first step is like giving yourself permission to recognize that this is important, that having fun matters, that being social is actually an important part of being a human. Because I know that many of us just feel like we are just go, 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 go all the time, and there's no time for us, and there's no time for self-care. And so, like, stopping to have coffee with a friend or, taking an art class or whatever feels like, oh, it's just too much. So giving yourself permission to recognize that you're a human being and that's part of being a good human being is taking care of yourself. Like, I think that's first step.
I'll tell you this, I'm giving myself a lot of permission. So I did my list was Becky while Becky was talking. Number one, I'm gonna do more dancing, just so you all know, okay? I'm gonna dance all over. Number two, Elizabeth has been promising for the three of us to have this retreat. Elizabeth, this is it. Your time has
Yes.
come. We're gonna put a
Okay.
date to this. No more, how is the saying in English? Going around the bushes. What is it?
Beating.
Around the bush.
No
No
more
more
of
dancing
that.
around the bushes,
No
Tara.
more dancing around the bush. No, we do want to dance around the bushes. Stop beating around the bushes so we can dance around the bushes and we're going to schedule these things. So that's what I'm doing. And I love the joy buddies. I'm going to make a list of who are 2 or 3 joy buddies and intentionally schedule something, right? Like whether it is that coffee or maybe a long phone conversation or short, whatever, I don't care. I'm giving myself permission because there is a cost if we don't agree.
But what would bring me joy? I was not keeping a list like Maria, but in my head, I was thinking as we were talking that Becky slipped in 2 book titles into this conversation, The Art of Gathering, which I have not read, and The Body Keeps the Score, which I have read. And I was thinking to myself, okay, can we get her back here just to talk about books? Because that sounds fun.
Yes, I
Yes,
love reading.
I do too. And I love all sorts of different kinds of books. And I love talking books. So always, always yes. And I have to ask a coach-like question, and you're welcome to yes, no counter. But when do you want to do the retreat by?
Exactly, Elizabeth. When do we want to
Well,
do the
yeah, we're
retreat?
doing it by the end of October because we're going to do some hiking, ladies, and it needs to be pleasant weather.
I don't want to go hiking. We've talked about this, but okay.
Yes. And we agreed that we're going to go anyway.
Dude, I want to go to the lavender farm.
Oh, but the lavender won't be blooming. But we
Um,
can go, but it won't be blooming.
okay.
There's also museum passes to things like the historic London town. So you could go and borrow a library pass and then have an adventure.
There you go. You see?
Options.
That
I'm
is a
an
great
options
idea.
girl.
I love it. Becky, thank you so much for joining us for this conversation. How can people, your message for listeners to maybe how to get in touch with you or how to, whatever, action step that people can take towards maybe connecting with you, what would that be?
Well, I'm on all the things. So LinkedIn, Facebook, Instagram. My website is joyworkllc.com. You're welcome to reach out there. I have a newsletter. I'm always sharing all sorts of joy spotting and upcoming events. And I'm in collaboration for a Jane Austen tea in December. So more of that will be coming out soon with a local business in Baltimore. So lots of fun, lots of joy. And thank you for being part of this.
And before you go, your book, how can people get it? Take a read?
Go to the
It,
library?
yes, it's at the library, but it's also on all the booksellers, Bookshop, Barnes and Noble. It's used copies on Amazon, but you can also get it directly through the ALA editions. That's the publisher. So it's definitely available. Check it out.
What?
And
I'm
it's
sorry, tell us what it's called again.
101 Seeds for Library Joy.
Ah,
And it's
yeah,
so cute
I'm
and whimsy.
it
And
is.
I
I
have
have one.
yes. See, look how cute. With lots of
Oh, I love it.
pictures.
Ooh, I love
So
that.
sometimes my clients get coloring pencils. Yeah, Joy to Go bag. This is one of my favorites. Make your
Oh,
bag into a Joy to Go bag. Isn't
nice.
that
Love it.
fun?
Love that.
I like
Thank
it.
you so
Well,
much for joining us today.
yeah.
Guys, I hope you loved this episode. If you did, please share it with a friend. Leave us a review on Apple Podcast and make sure to check out Becky wherever she is because I feel like she's an excellent person to have in your corner. So until next time. Hey trainers, listen up. If you're new to the gym floor and you're feeling a little bit lost about how to actually get clients, I've created something for you. I have a free mini course that walks you through exactly how to stand out, connect with members, and become the go-to expert at your gym. It's short, it's practical, and it'll give you real steps that you can start using in your business today. So if you're ready to stop waiting for clients to magically appear and actually build a busy, successful training business, grab my free mini course at terradeleonfitness.com. Thank you for listening. If you want to connect with me outside of this podcast, you can find me on Instagram at coaching_therapist.
I'm Elizabeth. You can find me at Elizabeth Harris Nutrition or in my Facebook group, Health and Healing with Intuitive Eating.
And I'm on Instagram and Facebook at Tara DeLeon Fitness. Guys, if you loved this episode or any of our other episodes, we would love it if you would leave us a review on Apple Podcast. It really, really helps us get the non-diet word out to the rest of the world. So please leave us a review.
Yes, thank you.